Hey there guys, good day. So I'm here to talk again about effects of testosterone on transgender men. So last time I covered hair loss and hair growth. Now we're going to talk about the other effects, and again we'll discuss the onset. Onset is when the effects start taking place, and how long before the maximum effect if applicable, and so on and so forth. The information I got this from is from the document by the Endocrine Society. They have a guide on how to treat trans people and non-binary people, the hormone guidelines. So let's begin. The first is skin oiliness and acne. So it's quite common when starting testosterone that your skin starts to secrete more oils and you develop acne. And this starts within the first 1 to 6 months of testosterone. And what you want to do to avoid it is to have a regular face cleaning regimen. So it's ideal to wash your face every night before you sleep with a mild facial wash, or with a facial wash that contains salicylic acid, because salicylic acid helps prevent acne. Another side effect of testosterone is, increased muscle mass or strength. So it's quite common, especially in the early months, that you develop some amount of muscle mass even without working out, which is really cool, right? But don't expect to become buff on testosterone alone. If you want to get bigger, then you have to exercise. The next effect is fat redistribution. What does this mean? It means that fat from certain parts of your body, the way your body stores fat is different. So in women, it's more common for fat to be held around the hips and around the waist and in the thighs, right? But for guys, usually the fat moves to the arms and the belly. So, and one of the cool effects is that there is some fat reduction in the chest, but don't expect it to make your chest go away. There's a slight fat reduction in the chest area. If you stop testosterone, though, the fat redistribution goes back to the way it was before, right? The next effect is cessation of menses. So this usually happens in the first 1 to 6 months. For some people, there are issues where the menses does not stop. So I know one case where a trans guy had to take, aside from testosterone, tamoxifen, right? But in most cases, you'll be fine. Menses will stop. Sometimes over the years, you might experience occasional spotting, which is normal. By the way, this video is not to be construed as medical advice. So it's publicly available information, but you really want to see a doctor. This is just to give you an idea of what to expect when you go on testosterone. Ideally, you are going to the doctor who is taking regular tests of your liver enzymes, your test levels, etc., as well as monitoring any side effects that you might be experiencing. So there's that. The other side effect is, or the other masculinizing effect is clitoral enlargement. So the clitoris is that little nub above your vaginal opening. And this little nub, it's actually made of the same stuff as the head of a penis. So it's like a mini penis, and when you're on testosterone, this grows. So you will have like a very small penis. It happens in the first 1 to 6 months. The maximum effect takes place in 1 to 2 years. Yeah. Then there's vaginal atrophy. What does this mean? So, your vagina kind of shrinks, and you also might experience vaginal dryness, and this is because of the lower levels of estrogen that your body is producing. So it's something that might or might not happen, and it's something that might or might not change. So you might experience vaginal dryness at the beginning, and later it resolves itself. This happens in the first 1 to 6 months, and the maximum effect happens in 1 to 2 years. And there's the deepening of your voice. So for some people, it starts to happen quite early, but according to the Endocrine Society, it happens in the first 6 to 12 months, and the maximum effect happens in 1 to 2 years. So what about effects that are not listed on their documents? So there will be changes in your body odor. There will be changes in the odor, not just from your armpits, from your sweat, but also around the genital area. And some of you might experience this, some might not. You might feel like your joints are kind of creaky, but it may or may not happen to you, right? So I think those are most of the effects covered. Yeah. So that's it. Hopefully you've learned something from this video, and we'll see you again next time.